Hi, everyone. Thank you so much for joining us today for the State of Healthcare Interoperability Summit. We're so pleased to be able to share this time with you. As Carol just mentioned, today really focuses around 5 panels with a keynote and takeaways at the end. We've shared the schedule with you, so you are more than welcome to pop in and out. We will have breaks in between our panel sessions as well, so you have a moment to step away, get a drink of water, etc., and come back. We're thrilled at the panelists that we've gathered today to really share what's going on in interoperability and what this state of healthcare interoperability really looks like. So a few key highlights. Today, you'll hear about data quality and usability. Obviously, data quality and usability is a key foundational topic to interoperability. You'll also hear about patient identity and matching as we move into a state where we need more interoperability. Patient identity and matching is key. Furthermore, you'll hear about popular and emerging use cases of interoperability, not to know maybe just what's going on within your organization, but what's going on broadly across the nation as well. You'll hear more from patients, consumers, and care partners about how they can be further engaged in the interoperable process. We, of course, know that interoperability is all about better patient care and better quality of care. So how can we further engage patients in interoperability? And then finally, you'll hear from our panelists about what does the future of interoperability look like? There's been a lot of key topics, key conversations that continue to happen. We hear terms like TEFCA and AI, et cetera, and we want to know what the future looks like. So this panel will talk a little bit more about what you might expect to see in the future. Make sure you stick around at the end to where the moderators will come back together and share their key takeaways from today so you can hear what we're tracking, what we heard, key themes and things that we'll be watching throughout the new year as well. Before we go there, I want to take a moment and introduce DirectTrust if you're not aware of DirectTrust. DirectTrust is a 501c6 nonprofit that was founded in 2012, focused around instilling trust in the secure exchange of health information. For many years, we've been known for the direct standard and direct secure messaging, but DirectTrust actually does much more than that. Our primary focus areas include membership, accreditation, standards development, and trust services. If you're interested in learning more about DirectTrust, I encourage you to visit our website at directtrust.org. Now it's time for us to dive into our opening keynote today. And I'm so pleased to share with you this opening keynote from Jodi Daniel. Jodi Daniel is an attorney with Crowell and Mooring, and she's the managing director of Crowell Health Solutions. She's partner and CHS managing director at Crowell and Mooring. As one of the first digital health lawyers in the United States and a former lead policymaker at the U.S. Department of Health and Human Services, Jodi has a broad and unique understanding of the digital health market and cutting-edge health innovation, including artificial intelligence and machine learning, remote monitoring tools, EHRs, mobile health applications, digital therapeutics, health data platforms, and data analytics tools. When I want a pulse of what's going on legislative-wise, regulatory-wise, and what might be upcoming, Jodi is one of the key resources that I turn to. And to kick off today's conversation around the state of healthcare interoperability, we thought that it's important to think about what's coming in the future. AI has obviously been a hot topic. We've heard a lot about it. Recently, we've heard about the executive order from President Biden. And interoperability does not exist in a vacuum. We know that interoperability is reliant upon data privacy, security, and technology. Those are very foundational to interoperability. So before we dive into the state of healthcare interoperability, we thought that it was wise to take a moment and learn more about what's happening with AI. We don't know exactly how AI is going to impact interoperability yet, but it's key that we have a foundational understanding of what's happening currently with AI and technology and what might be coming to kind of give us more information as we lead into the other panels today. So with that, I'm excited to introduce you all to Jodi Daniel to tell us a little bit more about her take on what's happening in the healthcare industry and AI within the US and globally as well. Thank you.
Thank you so much for inviting me to speak today. Good morning to those of you on the West Coast. Good afternoon to those on the East Coast. Today, I'm going to be speaking about the use of AI in healthcare, what we're seeing, the risks, and how government is responding. As many of you know, AI and machine learning systems and technologies have quickly become one of the greatest technological leaps of the 21st century, bringing new innovations across all industries, including in healthcare. In the US and across the globe, healthcare organizations continue to develop and incorporate AI and ML technologies with the goals of improving health outcomes and management, improving operations, reducing administrative burden for clinicians, and supporting patient engagement. AI is increasingly being developed and used in all aspects of healthcare in ways that will fundamentally affect how care is delivered, how new treatments are developed and deployed, and how patients and clinicians interact. This rapid technological advancement can solve some of the greatest challenges in healthcare, but also raises significant risks surrounding reliability, bias, and privacy. Policy has been developing, but it's much slower than technology. And this is consistent with what we see in all aspects of technology and the government sort of catching up to innovation. But it leaves uncertainty regarding government's oversight of AI in healthcare and can lead technology developers to wonder what may come down the pike from regulators, as well as those that are implementing that technology, healthcare providers and health plans, to make sure that they're doing it in a way that is consistent with the regulations today and the ones that may develop over time. So just looking at the landscape of AI, and defining some terms. So when I talk about AI in its simplest form, I'm talking about combining computer science and robust data sets to enable problem solving. When we talk about generative AI, which has gotten a lot more attention lately with ChatGPT, it is a form of AI that can quickly produce new content based on a variety of inputs, including like text, imagery, audio, information. And these really are fundamentally different than the AI that we have seen traditionally being employed in healthcare. So generative AI systems are really reasoning engines. I heard somebody really thoughtful talk about this and explain that they're not computers in the traditional sense, which really challenges sort of how we think about using this technology in healthcare. And I'll just explain it because I found this really fascinating, that a computer is a machine that can do perfect memory recall, like helping a clinician to follow practice guidelines, or perfect calculation, so to help determine the proper dose of a drug based on weight. But generative AI is creating new information, not just computing on existing information. So let's talk about some, before I get to like what's happening and what to think about, I just wanted to talk through a couple of examples that I'm seeing of the use of AI in healthcare. So people often just go directly to like diagnosis and treatment, and AI is being used in diagnosis and treatment. Particularly, I think one of the most notable examples is in medical imaging. The use of AI in radiology, for example, has the potential to improve and has been improving efficiency and efficacy in medical imaging and supporting image analysis. And we've seen already a lot of use and potential to improve patient safety through enhanced imaging processes and having AI technology that aids physicians in diagnosis and help minimize discrepancies. But we're also seeing AI being used to support many administrative functions. So one of the ones that is often touted is trying to address the problem of documentation. A lot of clinicians complain about the use of electronic health records and the burden of documentation of clinical visits. And this is an area where AI and even generative AI might be able to support clinicians in their day-to-day practice. We're also seeing AI in healthcare being used to help support communicating with patients. So we have seen the use of chatbots to support patient engagement and communication, to help provide the right level of information to a patient at the right time, and in a manner that might be more understood depending on their level of education, their socioeconomic status, et cetera. But there are also some examples that we're starting to see of using generative AI to communicate to patients in ways that we have not seen in the past, such as communicating more empathy and or incorporating empathy into the communication with patients and helping a provider to target their communication in a way that is more tailored to that patient's specific needs or circumstances. We're also seeing AI being used for patients directly, such as to decode information in the healthcare system. So, leveraging AI technology, for instance, to understand an explanation of benefits or an EOB, which is quite complicated, and a lot of individuals don't really know how to read those or what they mean. So, lots of different ways that AI and healthcare can be used to help improve care delivery, reduce burden, improve engagement with patients, improve patients in managing their own health and their own payment for healthcare. So, what are some of the issues that we're seeing with regard to using AI technology in healthcare? So, the first one that I always go to is data, data access, data privacy, et cetera. Generally, the creation of AI models requires access to a lot of sensitive data, which of course raises concerns about privacy and security of this data. There is also some confusion about how to use health data under HIPAA in testing and training of algorithms, and how those rules, which remember came out in 2000, apply to these new uses of data that were not contemplated when those rules were written. In addition to compliance with HIPAA, thinking about privacy and security, there's a lot of data outside of the healthcare system that may be useful in developing and training algorithms. There is health data that is just held outside of the clinical or the healthcare, the payer space, that may be similar to the data that is held within the HIPAA protected space. But there's also a lot of health related data that may be in consumer apps or social determinants of health data or social care data that can be really useful in training algorithms and may not be regulated by HIPAA. There's a complexity about the fact that there are certain data that has different kind of regulation or potentially no regulation of it. And that's important to understand and to navigate if you're in the space where you are trying to either work, where a health system is trying to work with a tech company to leverage data sources to make sure that the models are accurate and reflect a broad population. Goes to the next question, which is equity and bias. I don't think I've ever heard any conversation about AI, particularly AI in healthcare, where we don't talk about equity and bias. There's currently a lot of focus on health equity in general. And when we talk about introducing new technology and AI-enabled technology, we need to ensure we're not adding bias through the use of that technology. In some ways, if there is biased data, AI might exacerbate that bias by replicating it and using it in a model. But there are also opportunities to leverage AI to detect bias and to help reduce bias that occurs now in the healthcare system. Some questions that tech companies that are developing these tools should think about when looking at AI, or that users of these technologies should be thinking about, is who the AI system is designed for and what data went into the training of the system to make sure it's applicable to the particular use that you're intending. And then how can those biases that we talked about be detected and monitored? Another important issue is transparency. There is a lot of concern about technology that may not have, where the user may not understand how the technology works, or again, what data it was trained on. And it's really important that users understand the AI technology, the functions, the data that was used, and how to use that. What is the use case for which that AI technology is being advocated for in healthcare, to make sure that it is consistent with the way it was developed. And then, to me, most important above all of this is reliability and safety. We don't want to unleash technology into healthcare without knowing that it is reliable and safe. Which gets to the question of what are the best purposes for using AI in healthcare. So, for instance, let's talk about generative AI. And it's obviously, this is very new. People are still, it's evolving quickly, and people are still trying to understand how generative AI works and how to use it in healthcare. It may make a lot more sense to be thinking about using generative AI for an administrative purpose at this point, rather than a treatment purpose, where we know that there are some large language models that have hallucinations, where they're creating that data that may or may not be may not be factual, it may not be accurate. And so if that's the case in an administrative context, it's less risky than if it's in a treatment context. Of course, the other thing when we talk about safety and reliability is humans make errors all the time. Clinicians make errors all the time. And, we know this from decades ago when the Institute of Medicine came out with their report to err is human and identified some large percentage, I think it was like 17% of all hospital patients experienced a medical error at that time. So if an AI technology makes mistakes 5% of the time instead of 17% of the time, should we be using that? Or is there a tolerance for technology that may lead to some errors if it's reducing errors overall? These are not questions that have been answered yet, but really interesting issues to tackle as we're thinking about unleashing AI in healthcare. So last, I just want to focus on what's happening. How is the government, the private sector, different bodies thinking about these issues and how to ensure that AI for use in healthcare and as well as in other industries is being done in a responsible way? What's the right governance? What's the right oversight of AI in healthcare? And so I wanted to just talk about what is going on now and things to watch. First, I'll just go big picture and start globally. The World Health Organization has a document called Ethics and Governance of AI in Healthcare. They outline 6 key principles for use of AI in healthcare. And, it's helpful. It makes, a lot of sense, but they are pretty high level. These are really at a principle level and don't really give you concrete insights into how to incorporate AI into a healthcare context. So diving a little bit deeper is the EU AI Act, which is, they call it the world's first comprehensive AI law. The EU AI Act is not focused on healthcare. It is broader, but it would apply in the healthcare context and give some regulatory oversight to AI uses in healthcare in the EU. The EU AI Act follows a risk-based framework. It provides that AI systems that can be used in different applications are analyzed and classified according to the risk that they pose to users. And the different risk levels will mean more or less regulation, kind of like what the FDA does, right? There's different classifications of a device, for example, and different risk levels and different oversight requirements depending on those risk levels. So the risks that they have identified is an unacceptable risk AI system where there's a threat to people, and those would be banned. There are high-risk AI systems that may negatively affect safety or fundamental rights, and that they're going to have more strict safety regulations or registration requirements for these high-risk AI technologies. There are generative AI requirements, which would require a generative AI technology to comply with transparency requirements. And then there are limited risk AI systems, which would have some minimal transparency requirements, but allow users to make informed decisions. And I am actually in the EU right now, and have talked to somebody recently who informed me that they are in the final stages of the EU discussing and debating the EU AI Act, and I think it's supposed to be coming to the commission for the final phase on Friday. If I have my data correct, do not quote me on that. In the US, we have the most recently the executive order from President Biden that was signed on October 30th of this year. The executive order is on the safe, secure, and trustworthy development and use of artificial intelligence. Again, it's not focused on healthcare, but there are a lot of things in there that are specific to healthcare or that might relate to healthcare. The EO provides some clear direction regarding US policy on AI and established a framework for managing AI risks, directing federal action to regulate the use of health AI systems, and guides the development of tools to advance AI innovation across sectors, including in healthcare. The EO has 8 guiding principles and priorities to advance and govern the use of AI, all of which apply to healthcare. And just included in that list, to give a few that are relevant, is ensuring safe and secure AI technology, promoting responsible innovation, competition, and collaboration, and protecting American consumers and patients. The EO specifically calls on HHS to establish an AI task force within 90 days and to develop a strategic plan for responsible AI deployment within 1 year. The strategic plan, a couple of areas that they call on for this task force to focus on is development, maintenance, and use of predictive and generative AI-enabled technologies in healthcare delivery, safety and real-world performance monitoring of AI-enabled technologies, and incorporation of equity principles. And then finally, I'll just note, of course, privacy and security standards into the software development lifecycle. There's a couple of others, but just to highlight a few of the ones that sort of I think are of critical importance. The strategic planning for this task force will likely take a year, which of course leaves some uncertainty again as to what healthcare organizations and health tech companies that are developing or considering using AI-enabled technologies should be doing in the interim. There are a couple of things specifically in the EO of note that are more spelled out. Most notably, the establishment of an AI safety program by October of 2024, which in partnership with voluntary federally listed patient safety organizations would build on that previous work and establish a common framework for identifying and capturing clinical errors resulting from AI deployed in healthcare settings. And then lastly, I mentioned that this EO, what an executive order does, it only allows and sets direction for particular activities that the government already has authority to do. So it does build on an existing regulatory framework. At HHS, the couple things that I'd highlight in that regulatory framework is the FDA, which regulates medical devices, and including those that incorporate AI and ML technologies. And the FDA has issued guidance on AI-based software as a medical device and has approved a number of AI-enabled technologies. In addition, the HHS Office of the National Coordinator for Health IT, my old office, has proposed regulations on transparency related to predictive decision support interventions that are incorporated into certified EHR technology or electronic health records. We are likely to see these final rules very soon. They have gone over for review to the White House. And if I have a crystal ball, I would suspect that ONC is trying to get them out in time for their annual meeting, which is the end of next week. So stay tuned for that. And then lastly, I'll just note that Congress has been asking a lot of questions about AI and privacy, and they've been holding hearings on the topic. So there should be a lot more. There has been a lot more activity in Congress, and there could be some legislative activities at the congressional level. And finally, we're also seeing private sector activity. So I'll just note there's plenty of things going on. I'll just note a couple that I think are getting some attention. The first is the Coalition for Health AI, or CHAI, which has provided guidelines for the responsible use of AI in healthcare. And then one other activity that I'm involved with is the National Academy of Medicine AI and Healthcare Code of Conduct Initiative, which is building on the work of CHAI to develop a code of conduct for health AI for all stakeholders and at different parts of the life cycle of development of the health AI tools and use of those tools. So just there's a lot going on with technology development and incorporating technology and AI technology into healthcare products. We'll see innovations that will improve diagnosis and treatment, reduce burden for clinicians and patients, and help patients and providers communicate better. So there's really a lot to be excited about and a lot of opportunity. But like I mentioned, there is also a lot of risk if the technology isn't developed properly to focus on safety, privacy, ethics, and equity, and to do that in a way that builds trust of the users, the clinicians, and the patients that will be relying on this technology. We are seeing a lot of activity with regard to frameworks for governance, oversight, and use of AI in healthcare at all levels and across the globe. So there's a lot to keep an eye out on, and there'll be much more to discuss in the future. So with that, I would just like to thank you for having me and enjoy the rest of the conference.